Rheumatoid arthritis is an autoimmune disease that primarily affects which part of the body? A. Heart. B. Lungs. C. Joints. D. Kidneys. The correct answer is C. Rheumatoid arthritis primarily affects the joints, causing inflammation and pain. Osteoporosis is characterized by a decrease in bone density, leading to an increased risk of fractures. Which mineral deficiency is commonly associated with osteoporosis? A. Iron. B. Calcium. C. Magnesium. D. Potassium. The correct answer is B. Calcium deficiency is commonly associated with osteoporosis, as calcium is essential for bone health and density. Gout is a type of arthritis caused by the buildup of which substance in the joints? A. Uric acid. B. Cholesterol. C. Glucose. D. Sodium. The correct answer is A. Gout is caused by a buildup of uric acid crystals in the joints, leading to inflammation and pain. Which of the following is a common classification of cancer based on the tissue of origin? A. Stage 1. B. Sarcoma. C. Leukemia. D. Lymphoma. The correct answer is B. Sarcoma is a common type of cancer that starts in connective tissue, like bone or muscle. What factors influence the causes of cancer? A. Genetics. B. Diet. C. Environment. D. All of the above. The correct answer is D. The etiology of cancer can be influenced by genetics, diet, environment, and many other factors. Which of the following is a key pathogenic mechanism in rheumatoid arthritis? A. Excessive bone mineralization. B. Decreased joint lubrication. C. Autoimmune inflammation. D. Muscle wasting. The correct answer is C. Autoimmune inflammation is a key pathogenic mechanism in rheumatoid arthritis, leading to joint damage and pain. Osteoporosis is more common in which population group? A. Children. B. Young adults. C. Postmenopausal women. D. Elderly men. The correct answer is C. Osteoporosis is more common in postmenopausal women due to hormonal changes that affect bone density. An acute gout attack often brings on sudden, severe pain. Which joint is usually affected? A. Elbow. B. Hip. C. Knee. D. Big toe. The correct answer is D. An acute gout attack often presents as sudden, severe pain in the big toe joint, known as podagra. Which of the following is a common classification of cancer based on the type of cells from which it originates? A. Adenocarcinoma. B. Melanoma. C. Sarcoma. D. Lymphoma. The correct answer is A. Adenocarcinoma is a common type of cancer that starts in glandular cells. What is the primary pathogenic mechanism in osteoporosis? A. Excessive bone resorption. B. Inflammation of the joints. C. Autoimmune reaction. D. Overproduction of bone matrix. The correct answer is A. Osteoporosis is primarily caused by excessive bone resorption, leading to decreased bone density and increased fracture risk. Which crystals are typically deposited in the joints of patients with gout? A. Calcium pyrophosphate. B. Uric acid. C. Calcium oxalate. D. Sodium chloride. The correct answer is B. Gout is caused by a buildup of uric acid crystals in the joints, leading to inflammation and pain. Which of the following is a risk factor for developing rheumatoid arthritis? A. Genetic predisposition. B. Vitamin D deficiency. C. High calcium intake. D. Low body weight. The correct answer is A. Genetic predisposition is a significant risk factor for developing rheumatoid arthritis, along with environmental triggers. Which of the following cell types is commonly associated with the pathogenesis of cancer? A. Osteoblasts. B. Lymphocytes. C. Adipocytes. D. Carcinoma cells. The correct answer is D. Carcinoma cells are a common type of cancer cell that originates from epithelial tissues. What is the main cause of gout? A. High calcium intake. B. Genetic mutations. C. Elevated uric acid levels. D. Low dietary protein intake. The correct answer is C. Gout is primarily caused by elevated uric acid levels in the blood, leading to the formation of uric acid crystals in the joints. Which of the following bone cells is responsible for bone resorption in osteoporosis? A. Osteoblasts. B. Chondrocytes. C. Osteocytes. D. Osteoclasts. The correct answer is D. Osteoclasts are bone cells responsible for bone resorption in osteoporosis, breaking down bone tissue and leading to decreased bone density. What is one of the key risk factors for developing osteoporosis? A. Regular weight-bearing exercise. B. High calcium intake. C. Older age. D. Low vitamin D levels. The correct answer is C. Older age is a significant risk factor for developing osteoporosis, as bone density tends to decrease with age. Which inflammatory cytokine plays a critical role in rheumatoid arthritis? A. Tumor necrosis factor. B. Interleukin 8. C. Interleukin 6. D. Transforming growth factor beta. The correct answer is A. Tumor necrosis factor, or TNF, plays a crucial role in rheumatoid arthritis. It promotes inflammation and joint damage. Which cancer classification refers to tumors originating from glandular epithelial cells? A. Leukemia. B. Lymphoma. C. Carcinoma. D. Sarcoma. The correct answer is C. Carcinoma is a cancer classification. It refers to tumors originating from glandular epithelial cells. These make up the majority of cancers in the body. What is the most common pathological hallmark of rheumatoid arthritis? A. Synovial inflammation and hyperplasia. B. Osteoclast activation. C. Bony nodules formation. D. Tophi deposition. The correct answer is A. Rheumatoid arthritis is characterized by synovial inflammation and hyperplasia, leading to joint destruction and deformities. Which cell type is mainly responsible for causing rheumatoid arthritis by making autoantibodies? A. T lymphocytes. B. Neutrophils. C. B cells. D. Macrophages. The correct answer is C. B cells play a crucial role in rheumatoid arthritis by producing autoantibodies, such as rheumatoid factor and anti-citrulline protein antibodies. What is the most common type of cancer classification based on the tissue of origin, and used to determine the cancer's primary treatment approach? A. Sarcoma. B. Lymphoma. C. Carcinoma. D. Blastoma. The correct answer is C. Carcinoma is the classification used for cancers that originate in epithelial cells, such as breast, lung, and colon cancer. What factor most increases uric acid production, causing gout? A. High calcium intake. B. Alcohol use. C. Lots of exercise. D. Low purine-rich food intake. The correct answer is B. Alcohol consumption can lead to increased uric acid production, contributing to the development of gout. Which bone cell type is mainly responsible for bone breakdown in osteoporosis? A. Osteocytes. B. Osteoblasts. C. Chondrocytes. D. Osteoclasts. The correct answer is D. Osteoclasts are the bone cells responsible for bone resorption in osteoporosis. This leads to decreased bone density and increased fracture risk. Osteoclasts are bone cells responsible for bone resorption in osteoporosis. What is their primary function? A. Bone formation. B. Bone mineralization. C. Bone resorption. D. Bone remodeling. The correct answer is C. Osteoclasts are bone cells responsible for bone resorption in osteoporosis. Their primary function is to break down and resorb bone tissue. Which factor most increases uric acid production, leading to gout? A. High calcium intake. B. Low vitamin D. C. High purine intake. D. Low vitamin C. The correct answer is C. High dietary intake of purines significantly contributes to the development of gout by increasing uric acid production. Which of the following is a key risk factor for developing osteoporosis? A. Regular weight-bearing exercise. B. High calcium intake. C. Family history of osteoarthritis. D. Postmenopausal women. The correct answer is D. Postmenopausal women are at a higher risk for osteoporosis due to hormonal changes affecting bone density. Which of the following bone cells is primarily responsible for bone resorption and breakdown in osteoporosis? A. Osteoblasts. B. Chondrocytes. C. Osteocytes. D. Osteoclasts. The correct answer is D. Osteoclasts are the bone cells primarily responsible for bone resorption and breakdown in osteoporosis. What is the main cause of gout? A. Obesity. B. High cholesterol levels. C. High uric acid levels. D. Sedentary lifestyle. The correct answer is C. High uric acid levels, typically due to diet or genetics, are the main cause of gout. Which cancer classification refers to tumors originating from glandular epithelial cells? A. Sarcoma. B. Leukemia. C. Lymphoma. D. Carcinoma. The correct answer is D. Carcinoma refers to cancers originating from glandular epithelial cells, such as breast or lung cancer. What is the most common pathological hallmark of rheumatoid arthritis? A. Uric acid crystals in joints. B. Synovial hyperplasia and inflammation. C. Osteoclast activation. D. Bone demineralization. The correct answer is B. Synovial hyperplasia and inflammation are the most common pathological hallmarks of rheumatoid arthritis, leading to joint destruction and deformity. Which of the following is a risk factor for developing osteoporosis? A. Young age. B. Female gender. C. High calcium intake. D. Regular weight-bearing exercise. The correct answer is B. Female gender is a significant risk factor for osteoporosis due to hormonal changes affecting bone density over time. Which of the following factors is a key cause of gout? A. Obesity. B. Low purine diet. C. Alcohol consumption. D. Avoiding red meat. The correct answer is A. Obesity is a significant contributing factor to gout. It's associated with increased uric acid production, leading to crystal deposits in the joints. Which bone cell type is mainly responsible for bone breakdown in osteoporosis? A. Osteoblasts. B. Osteocytes. C. Chondrocytes. D. Osteoclasts. The correct answer is D. Osteoclasts are bone cells specialized in resorbing and breaking down bone tissue, leading to decreased bone density in osteoporosis. Which factor significantly contributes to gout by increasing uric acid production? A. High vitamin C intake. B. Low alcohol consumption. C. Dehydration. D. Low purine diet. The correct answer is C. Dehydration can lead to increased uric acid levels in the body, contributing to the development of gout. Which inflammatory cytokine is key in rheumatoid arthritis, causing joint inflammation and damage? A. Interleukin 6, IL-6. B. Interleukin 10, IL-10. C. Tumor necrosis factor alpha, TNF-alpha. D. Transforming growth factor beta, TGF-beta. The correct answer is C. Tumor necrosis factor alpha, or TNF-alpha, is a key inflammatory cytokine in rheumatoid arthritis, promoting joint inflammation and destruction. Which classification of cancer refers to tumors originating from glandular epithelial cells? A. Carcinoma. B. Sarcoma. C. Lymphoma. D. Leukemia. The correct answer is A. Carcinoma is a common cancer classification for tumors derived from glandular epithelial cells in organs such as the breast, lung, or colon. Which bone cell type is responsible for bone resorption in osteoporosis? A. Osteoblasts. B. Osteocytes. C. Chondrocytes. D. Osteoclasts. The correct answer is D. Osteoclasts are specialized cells involved in bone resorption and breakdown, leading to decreased bone density in osteoporosis. What is a key risk factor for developing osteoporosis in postmenopausal women? A. Hormone replacement therapy. B. Regular weight-bearing exercise. C. High calcium intake. D. Estrogen deficiency. The correct answer is D. Estrogen deficiency after menopause is a significant risk factor for osteoporosis, due to its role in maintaining bone density. Which of the following bone cells is primarily responsible for bone resorption in osteoporosis? A. Osteoblasts. B. Chondrocytes. C. Osteocytes. D. Osteoclasts. The correct answer is D. Osteoclasts are bone cells responsible for bone resorption in osteoporosis, breaking down bone tissue. What is the main cause of gout? A. Vitamin D deficiency. B. High cholesterol levels. C. Elevated uric acid levels. D. Low calcium intake. The correct answer is C. Gout is primarily caused by elevated levels of uric acid in the blood, leading to crystal formation in joints. Which of the following is a common classification of cancer based on tissue origin? A. Carcinoma. B. Sarcoma. C. Lymphoma. D. Leukemia. The correct answer is A. Carcinoma is a common cancer classification based on tissue origin, specifically from epithelial cells. What substance's excessive production causes gout? A. Calcium. B. Uric acid. C. Sodium. D. Potassium. The correct answer is B. The pathogenesis of gout is primarily caused by excessive uric acid production in the blood. Which of the following is a common pathway involved in the pathogenesis of rheumatoid arthritis? A. Increased bone density. B. Chronic joint inflammation. C. Osteoclast activation. D. Uric acid crystal deposition. The correct answer is B. Chronic joint inflammation is a key pathogenic mechanism in rheumatoid arthritis, leading to joint damage and deformity. What is a significant risk factor for developing osteoporosis in postmenopausal women? A. Regular weight-bearing exercise. B. Hormonal changes. C. High vitamin D intake. D. Low calcium consumption. The correct answer is B. Hormonal changes, specifically a decrease in estrogen after menopause, significantly increase the risk of osteoporosis in postmenopausal women. Which classification of cancer refers to tumors that originate from bone tissue? A. carcinoma, B. sarcoma, C. lymphoma, D. leukemia. The correct answer is B. Sarcoma is a type of cancer that starts in the bones, soft tissues, or cartilage. What is the primary underlying cause of osteoporosis? A. Autoimmune response. B. Increased bone formation. C. Decreased bone density. D. Altered joint mechanics. The correct answer is C. Osteoporosis is characterized by decreased bone density, which increases the risk of fractures. Which of the following factors significantly contributes to gout by increasing uric acid production? A. High vitamin C intake. B. Low purine-rich diet. C. Excessive alcohol consumption. D. Genetic predisposition. The correct answer is C. Excessive alcohol consumption can lead to increased uric acid production, contributing to gout.